Welcome to the Hawaii Employer Union Health Benefits Trust Fund Retiree Open Enrollment Informational Session. We will be sharing some important information regarding this year's open enrollment for EUTF retirees. Our topics will include health plan options, plan changes for 2026, health and wellness programs, Medicare Part B reminders, and how to make changes to your plan. EUTF medical and prescription drug plan options for non-Medicare retirees include the HMSA 9010 PPO plan and CVS prescription drug plan and the Kaiser Permanente HMO plan. EUTF medical and prescription drug plan options for Medicare retirees include the EUTF HMSA 9010 PPO plan, Humana Medicare Advantage PPO plan, Silver Script prescription drug plan, and the Kaiser Permanente Senior Advantage HMO plan. Additional EUTF plan options include for dental coverage HDS Hawaii Dental Service, for vision coverage VSP Vision Service Plan, and Secure and Financial for life insurance. The 2026 EUTF Retiree Health Benefits Highlights Guide was mailed to all retirees and is also available on our website at eutf.hawaii.gov. The Retiree Health Benefits Highlights Guide provides retirees with important information on EUTF health benefits for plan year January 1st, 2026 till December 31st, 2026. For more information on 2026 premium rates effective January 1st, 2026, see the monthly health plan premium section starting on page 35. Retirees who receive less than 100% employer contribution towards the base monthly contribution should use the Retiree Premium Calculator available on the EUTF website at eutf.hawaii.gov/EUTF-premium-calculators/ to calculate their share of the premium cost. What's new for 2026, effective January 1st, 2026, unless otherwise specified? Eligibility criteria changes, effective July 1st, 2025. Dependent children ages 19 through 25 are eligible to enroll in EUTF and HSTA, VB retiree medical, prescription drug, dental and vision coverage through age 25, regardless of student or marital status, and they do not need to live with the retiree. Open enrollment is your opportunity to re-enroll your child if they were previously removed. HMSA has added 100% in-network coverage not subject to the deductible for the Diabetes Prevention Program under the EUTF and HSTA VB retiree plans. Participating programs currently include the KTA Puainako Pharmacy, National Kidney Foundation of Hawaii, and Queens Medical Center. Virtual classes are conducted by a CDC certified lifestyle coach, and the program consists of weekly sessions for the first 4 months and bi-weekly thereafter, 22 sessions total, limited to once per lifetime, and the program must be completed in 24 months. Added 100% in-network coverage, not subject to the deductible, and out-of-network coverage at the same benefit level as screening services for an annual preventive skin cancer screening by a specialist under the EUTF and HSTA VB retiree plans. Added coverage of chlamydia and gonorrhea screenings for men at the same benefit level as women under the EUTF and HSTA VB retiree plans. HMSA has added 80% coverage subject to the deductible for medical nutrition therapy under the EUTF retiree plans. Removed the developmental delay exclusion for physical and occupational therapy under the EUTF and HSTA VB retiree plans. Added coverage for cardiac rehabilitation at the same benefit level as physical and occupational therapy under the EUTF and HSTA VB retiree plans. Remove the member cost share up to the eligible charge and application of the deductible for out-of-network immunizations under the EUTF and HSTA VB retiree plans. For CVS, plan changes apply to EUTF non-Medicare retiree plans only. Added the antipsychotic class to the generic step therapy program under the EUTF non-Medicare retiree plans effective April 1st, 2025. Existing members using an antipsychotic drug will be grandfathered. Implemented the basic control formulary under the EUTF non-Medicare retiree plans effective July 1st, 2025, where utilization management was added to non-preferred products in 10 specific drug classes. CVS has implemented hyperinflation management under the EUTF non-Medicare retiree plans effective July 1st, 2025, where hyperinflated drugs that have a readily available, clinically appropriate, and more cost-effective alternatives are excluded. Revised prior authorization criteria for anti-diabetic GLP-1s and added a cumulative fill edit on anti-diabetic and weight loss GLP-1s simultaneously under the EUTF non-Medicare retiree plans effective July 1st, 2025. GLP-1s include, but is not limited to, Ozempic, Mounjaro, Rybelsus, Trulicity and Victoza for diabetes, and Saxenda, Wegovy, and Zepbound for weight loss. Added prior authorization requirements for non-specialty dermatologic products under the EUTF non-Medicare retiree plans. Existing members using a non-specialty dermatologic product will be grandfathered and will not need to obtain prior authorization. HDS has added 80% coverage subject to the annual deductible for posterior composite fillings under the EUTF and HSTA VB retiree dental plans. HMSA, Kaiser Permanente, and Humana offer health and wellness programs to help you get healthy and stay healthy. They include discounts on fitness centers and health and well-being products and services. Additional information can be found on the EUTF website under the Health and Wellness section. Preventive care is a great way to fend off illness and disease and preserve your overall health. HMSA, Kaiser Permanente, and Humana offer annual physical exams, preventive screenings, and immunizations, all at little to no cost to you. Health resources for HMSA include online care and health and well-being support through My Account. Health resources for Kaiser Permanente include Manage Your Health at kp.org, and health resources through Humana include My Humana. Getting the most out of your plan. Generic versus brand. Generic drugs are an affordable alternative to brand name drugs and can save you up to 80% in your out-of-pocket costs. Check with your doctor if a generic alternative is available for you. Mail order versus retail. Mail order can save you time and money if you are on maintenance medication. Mail order allows you to receive a 90-day supply for 2 30-day co-payments. Alternatives to ER visits. ER visits come with a substantially higher cost compared to regular doctor's visits and may increase premium cost shares. Alternatives to the ER include urgent care clinics such as Minute Clinic, online care, or office visits with your doctor. Explanation of benefits. An EOB is a document from your health insurance that details how a medical claim was processed. EOBs include the date you received the service, the amount billed, the amount the insurance paid, and any balance you're responsible for paying the provider. It also lists the amount credited toward any required deductible. Advanced care planning is the ability to document your health preferences in the event you are no longer able to make important health decisions. For more information on healthcare planning, see your primary care provider. Mandatory Medicare Part B enrollment. All Medicare-eligible retirees and covered dependents who are eligible for Medicare Part B must enroll in Medicare Part B in order to be enrolled in the EUTF Retiree Medical and/or Prescription Drug Plan. Proof of Medicare Part B enrollment. Retirees must provide a copy of their Medicare card to the EUTF indicating Medicare Part B enrollment within 60 days of becoming eligible or enrolling into an EUTF Retiree Medical and/or Prescription Drug Plan. Medicare Part B Premium Reimbursement. Reimbursement eligibility. Quarterly Medicare Part B premium reimbursement is only available for retirees and their eligible spouse or partner who pay Medicare Part B premiums. Enrollment into EUTF retiree coverage is not required to qualify for Medicare Part B reimbursements. Reimbursement will be effective the later of effective date of Medicare Part B coverage or the first day of the month EUTF receives proof of enrollment in Medicare Part B and a valid direct deposit agreement form. In addition, proof of payment to the Social Security Administration or Centers for Medicare and Medicaid Services is required to begin Medicare Part B reimbursements. Retirees must submit proof of enrollment in Medicare Part B, example, a copy of your Medicare card, and direct deposit agreement form for Medicare Part B reimbursement, and also the proof of payment to the Social Security Administration or Centers for Medicare and Medicaid Services. For this year's open enrollment, the election period begins October 16 through the 31st, 2025. During the election period, retirees can enroll, cancel or change plans, add or remove dependents, or change coverage tiers, such as changing from self to family or family to two-party. To make changes, submit an EC2 enrollment form or EC2H for retirees enrolled in HSTA VB benefit plans. Submit required supporting documents, and if you will be paying all or a portion of your health premium, complete the ERS pension deduction or ACH deduction form. No action is needed to continue your current plan enrollment. Examples of required supporting documents include the following. If you want to enroll yourself, no documents required. To add a spouse or partner, we will need a marriage or civil union certificate or domestic partnership forms and 2 sets of documents showing shared residency. To add a dependent child, we would need a birth certificate or guardianship decree if legal guardian, or adoption decree if child is placed for adoption or adopted. For change requests, please complete all sections except for coverage start date of the EC2 enrollment form or EC2H form for HSTA VB retirees, available at eutf.hawaii.gov or in your Retiree Health Benefits Highlights Guide. Please note, HSTA VB retirees can switch to EUTF plans but cannot switch back to HSTA VB plans and cannot be enrolled in both EUTF and HSTA VB plans simultaneously. The EC2 or EC2H form must be submitted along with required supporting documents to the EUTF office in person or by mail, postmarked by October 31st, 2025 to EUTF 201 Merchant Street, Suite 1700, Honolulu, Hawaii 96813. This concludes our session for today. We hope the information we provided has been informative and helpful. Mahalo from the EUTF for your time and attention.